ambulance. What's the emergency?
Quickly, we're at Southport.
Okay.
On
The Gold Coast, where the lights burn bright and the sunshine never ends. While many Aussies call it home, every year, 12 million tourists come to play on this stretch of golden coastline.
He was surfing when he got bitten on both legs by a shark.
I don't think I'm going in the sea again.
But the good times can often turn ugly.
I want the pelvic binder on him, OK?
And when they do,
She's not breathing.
these are the people you want on your side.
Nothing that we can't fix, sweetheart, right?
I know.
I'm still very concerned about this man. There's nothing like Ebola.
Whether you're just visiting or you live here,
My baby's life is going to be cut shorter because of this.
They don't want to see me die.
She can't be replaced.
these are the real stories
I love you too, buddy.
of the cutting-edge medical teams
Do not move your head.
We need to go in and get that clot out straight away.
Good work, guys.
who pick you up,
Okay, let's get moving.
It's the best job I've done anyway, nailing things.
patch you up,
Superpower! The fairy dust. It's very magical and it fixes all sorts of things.
and put you back in paradise. Tonight on Gold Coast Medical, a deadly one-punch attack.
If this guy doesn't die, there's a good chance he's going to end up with a horrible brain injury.
The wake-up call which changes lives.
Now, to cut a long story short, it may be that you've had a heart attack.
The race to save Daryl's dying heart with a balloon.
When it comes to heart attack, time.
You may get some chest pain. We're inflating the balloon now.
And a very special sperm donor
She's biting me.
delivers a miracle.
I've got one intubated patient coming in.
The emergency department can be frenetic at any time of the day or night.
Go, you guys been sorted? Just find out the patient's name and we can find out which ward they're on.
Keeping it running smoothly is the job of nurse team leader Simone Stevens.
This is pretty nice for me. Hectic is when the phone doesn't stop ringing and I haven't weed and it's just chaos. I've always been very loud and I laugh a lot. Mr. Young, how are you, darling? If you can be the happy leader that people feel comfortable to come to, then you are going to have happy, productive staff. You know, it doesn't matter who you are. You know, I've got a couple of minutes for you to say, hey, how are you? And a smile and a hug. And I think that's what makes my shifts, I don't know, probably hopefully more enjoyable for the staff. I like anything from a big banana. I was voted the most promising to go to NIDA and be an actress when I was in high school. I don't know how I became a nurse. My nickname is the Shit Magnet. I've had that for quite a few years now. Let me just see if I can... People joke about it all the time, including the ambulance, the police, the staff, everyone. They will walk in and go, oh, my God.
And true to form, Simone's day just got a whole lot busier.
Emergency, Simone speaking.
A rescue chopper is inbound carrying a critically ill patient.
There's a chopper about to land with an intubated patient. The chopper that's coming in is a 41-year-old male who was cowardly punched last night, whacked the back of his head. We see this all the time. Usually there's a bleed.
The one-punch attack happened in a northern New South Wales town where the man has spent the night in the local hospital.
He's been stable overnight. This morning he's started having seizures and he's not talking, he's confused. He's obviously got some sort of head injury. They have put him on life support to get him up here safely.
The man's seizure could have been caused by a bleed in his brain. The resulting build-up of pressure inside his skull may be restricting blood flow to vital brain tissue.
I'm Raoul, hey.
Quiet, please.
He'd been drinking heavily, was hit in the back of the head. He had a seizure this morning around 8 o'clock, was given about a total of 15 milligrams of midazolam with no termination of the seizure. But we put a collar on after he's become unconscious, so we're thinking head injury.
Thank you.
No worries.
The emergency team, led by Dr. Raoul Deshpande, start from scratch to make sure they know everything there is to know about this bloke's injuries.
What other injuries has he got? You know, has he, got a fracture in his spine? Is there anything else?
Got two scratch marks to his upper left back.
It's like a detective game. The only thing that's in his pockets, $1.10.
So let's get a chest X-ray.
There are no injuries on the man's body.
That looks okay. Thanks, guys.
But with one-punch attacks, often the only trauma is a hemorrhage at the back of the brain.
All right.
We keep telling people one punch can kill, and it's not the punch that kills you, it's the fall. And usually you end up with a bleed. If this guy doesn't die, there's a good chance he's going to end up with a horrible brain injury. And that's it. That's, he's 41. That's not old.
Friday afternoon on the Gold Coast. Sun lovers everywhere are getting ready to kick their heels up for another awesome weekend. But on the other side of town, critical care paramedics have just received an urgent call.
Ambulance, tell me what's happened. Says one driver trapped, conscious and breathing. The other driver is out.
There's been a major head-on collision between two cars travelling at high speed. A driver has fallen asleep at the wheel and ploughed directly into oncoming traffic. Joining the chaotic scene is Gold Coast born and bred critical care paramedic Jay Newton.
We've got 3 patients, one elderly lady who's still in the car at the moment. She's got multiple injuries, so we're just working on stabilising her and getting her ready to be extricated. We've got 2 other patients, one with some minor injuries and the other one who we'll just take up to the hospital for assessment.
The lady trapped inside is 57-year-old Elaine. The other driver and his passenger have minor injuries, but can see Elaine is not in a good way.
Yeah, she's in really good hands, okay? Hey, mate. Jay from the trauma response team. We want to get her out this side. She's got multiple injuries. She's got a chest injury, can't feel her foot, so that's our main. We're concerned that she's possibly done quite a significant injury there. We'll just get some access and some pain management. We'll probably sedate her and pull her out.
Elaine has no feeling in her foot. Time is more critical than ever.
We're ready.
Firefighters used the jaws of life to tear through the car doors. Considering the carnage, the fact that Elaine is conscious and talking is astonishing.
Hello, how are you feeling at the moment? How's your pain? How bad is it out of 10? And where does it hurt the most?
From what Jay can see, she has severe lower limb and possible abdominal injuries.
We're going to give you some really strong painkillers now, okay?
To help Elaine deal with the pain, they're giving her the dissociative pain relief drug, ketamine. It will give her an out-of-body-like experience to help her forget the trauma.
We're just going to knock her out. Elaine? Elaine?
As the rescue team pull her out of the car, the severity of her leg injuries becomes apparent.
It doesn't look good.
And then her husband arrives on the scene. Becoming a mum has been a big dream for 29-year-old Carly ever since she was a little girl. But her journey, she knew, would always be a difficult one.
I found out when I was in my early 20s that I was infertile. So I knew that if I was ever going to have a child, it was going to be a long process and I'd have to do IVF.
But that wasn't the only problem.
I've got endometriosis and I've also got a couple of other fertility issues as well.
Heartbreakingly, the odds seemed stacked against her.
So they did a test called an AMH test, which basically looks at your egg reserve, and mine came back, it was very, very low. Well, he said at the time I had about 12 months left of eggs. Being told that I only had 12 months and then being told I'm going to need minimum $10,000, it was obviously a bit of a shock.
It was an especially tough time and a lot of pressure on a brand new relationship.
We'd been together officially for about 2 months. And I said, well, I'm going to be doing this. If you want to stay with me, that's okay. If you don't want to be around, I completely understand. We've only been together a couple of months. And it's lucky because it took us a couple of years to get where we are.
Where they are is happily 36 weeks pregnant, expecting an ever so precious baby boy.
I'm Ellie Jane. I tattoo. I'm lucky enough to date Carly.
People look at us differently. People say things, whether it's to us or to each other, but you can hear them.
The best part is getting ultrasound and they assume they're like, are you the sister or the friend? But when they ask, they're like, are you...
Lesbians. Yes, they are. Blissfully in love after a whirlwind romance, done the modern way.
Ali actually tattooed one of my friends and I really admired her work and she said, oh, I'll add her on Facebook and the rest is history, really. She ignored me for ages, actually. I messaged her a lot and commented on all her posts and she just ignored me, but eventually she realised I was there.
For Ali Jane, it's been an equally tumultuous few years.
Telling my family was hard. They didn't understand why we wanted kids so quick and it was so hard to explain that it's a ticking time bomb. Emotionally, that really hit a 27-year-old really hard, knowing you only have 12 months left. And the funds you need for IVF, the emotional support. I think it did us really well, though, because we've had those, I think, how many times did we do it? 4? All up? Yeah. And each time, I think we just got closer.
The mums-to-be have had to go through 4 rounds of IVF at a private clinic, each time experiencing greater disappointment and sadness.
They found that I had what's called a lupus anticoagulant antigen, so that can cause miscarriages. Your body doesn't recognise, it sort of thinks of the baby as, I guess, like a foreign body.
In essence, Carly's own body was fighting and ultimately killing off her fertilised eggs.
The last minute we said, no, let's give it one more go. It was the day of the scan and we were just not excited at all. I couldn't even look at the screen. I was just looking at Ali and I just said to her, tell me when you see a heartbeat. And I saw her face and it was happy, so I knew something was good. And here we are.
Do you like it?
It's lovely.
Carly, act happier.
Strong, healthy, really good heartbeat. Very lucky.
I think it's cute.
It is cute. It's very cute. I'm in the low-risk, normal, boring pregnancy, which is what we want.
One thing this couple doesn't do is boring. So when it came to choosing the sperm donor, they didn't disappoint.
We keep telling people one punch can kill. It's not the punch that kills you, it's the fall. And usually you end up with a bleed. Way too often. Yeah, excuse me. Emergency, Simone speaking.
It's a busy morning in the emergency department, where the team is dealing with a victim of a one-punch drunken attack. The man's head hit the pavement, and hours later, he suffered a seizure.
Glucose is 7.3, bicarb is 20.7, so that's acceptable.
When he was first admitted to hospital, doctors had to sedate the man because he was drunk and aggressive with staff.
Fast is negative.
Unfortunately, patients that have been cowardly punched are often really intoxicated. So we need to scan their head to see, are they just intoxicated and acting like idiots, or are they actually agitated because of a bleed in their head? Are you guys using contrast as well? No.
So obviously we're worried about a head injury, maybe a fractured skull, a bleeding inside the brain, which may need urgent surgery. So we don't know actually what the cause is, but given the fact that he's fallen onto concrete, we're worried about these couple of things.
Everyone happy? Yep. All right.
Could potentially be damage for life from this one injury. Just want to see the head and then go. Nothing neurosurgical. Okay, cool. No, nothing.
Cleared of a brain injury, the team suspect the seizure may have been caused by excessive alcohol.
But that's probably good news for him. Right, so we'll just take him back to emergency. I'd say he'll probably stay intubated at least most of today, and then they'll just assess him a little bit later and see what he's like. Sorry. Emergency, Simone speaking.
He made a lucky escape from a serious head injury, and 48 hours later, miraculously, he walked out of the hospital and back into his life.
It must be you.
Those are not my lips.
First-time mums Carly and Ali have been looking forward to having a baby together for a long time.
We've had different donors for each cycle. Most Australians actually stipulate that they don't want their sperm going to same-sex couples. So that ruled most of them out anyway. Looks like he's yelling. He's got the pout on.
I don't reckon you can tell what they look like.
Well, all we know, he's got big lips and fat cheeks. We knew what we wanted straight away. We wanted African-American, so obviously that wasn't going to be an Australian anyway. So they specially ordered an African-American sperm donor in for us. Do you want to see your brother?
You won't be the favourite anymore. Doesn't care.
Working in foster care, I've seen a lot of mixed-race babies and they're just beautiful.
It's been a tough journey after 4 devastating failed IVF attempts.
We were really scared because every time we got to the 6 to 8 week mark, a miscarriage happened. So we're like, OK, we'll just make it 12 weeks. And then every week we're like, we'll just make it to the next one, we'll just make it to the next one. And we're so scared of losing him that we couldn't get happy. Like, you just can't. It was really hard.
But in the early hours of this morning, things finally got real. Their African-American baby boy is on his way. A few weeks early, just to keep them on their toes.
She woke up with pains, and then 3:30 she woke me up, and she was 5 centimetres dilated, like pretty quick, like within an hour. The tattoos were a build up to this pain.
I'm not sure they'll do it justice, hey? No. I think she's realising that. Yeah, this is different altogether.
As well as Ali Jane, Carly has called in her mum to be by her side.
It was like 3 o'clock, she rang me up, and I thought I'll lay back in bed for half an hour, and then within half an hour I got another phone call to say, I think it's going to be quick, you better get to the hospital. So, yeah, grabbed a Macca's coffee on the way, and here I am.
This moment has been a long time in the making, so Carly has already got a clear vision of the birth.
I want it very calm in there, so I want dark lighting. I'm hoping to be in the birth pool and just be able to pretty much birth him myself while the midwives stand by. I don't want any yelling, which comes down to me, I suppose.
I would like a DJ. Playing my favourite hits.
You got a real bit, that's what happened.
Either way, they're in good hands with midwife Ellen McLean.
To see a woman who is just working with her body to get through all that and to listen to it. And sometimes women have that on their own, and sometimes I know they have it because I'm there with them. They're proud of themselves, and you feel like a warrior queen.
With every contraction that passes, the mums-to-be get closer to meeting the baby of their dreams.
What's his name? Oakland. Oakland? Yeah. That's different. Okie. Okay.
I liked the name Oakland and I proposed it to Carly. And then she said because I got the first name, she has to choose the middle name, which is...
Vance.
Why is it Vance?
Because I guess we have a song which is by Vance Joy, and so we wanted Vance in his name because that's very special to us.
And corny.
Very corny.
We're those mums.
Certainly everything and everyone is ready for baby Oakland's arrival. But it appears maybe he isn't just yet.
I feel something in my vagina.
That's me.
I can think of it. Not this time.
Critical care paramedics are rescuing Elaine from her mangled car, moments after she collided head-on with another driver.
She's got multiple lower leg fractures. You can see her bones sort of sticking out.
And just as they get Elaine safely onto the trolley, her worried husband arrives to be by her side.
So you just don't worry about anything, all right?
Yeah. Elaine's legs are not in a good way.
See how she goes with that?
Oh.
Okay, hang on. It's not enough.
She has multiple open wound fractures and severe pain in her chest from the impact of the crash. Critical care paramedics must get her to the hospital immediately, where a major trauma call has gone out. A team of specialist doctors is on standby for Elaine's arrival.
She's stable at this stage. We'll be there probably about 10 minutes.
Orthopedics, intensive care and a surgical trauma team will all work together on Elaine.
Any pain here at all? You have some pain in the knee?
Oh, yeah.
Yes.
She has two injuries which are quite significant, being that they're open injuries, meaning that there's bone protruding from the skin, patella and around the left ankle. So it's something that we have to manage, fairly quickly.
The fact that she has bones protruding through her skin means the risk of infection is high.
So we can just make sure about the antibiotics.
Elaine is pumped with antibiotics.
2 grams of Epsom.
This will buy them enough time to do CT scans to determine what injuries she has.
Darling, darling, you know that we are sold out. This is fading, but the band plays on now. We're crying.
57-year-old Elaine has been involved in a head-on car crash.
She has two injuries which are quite significant, being that they're open injuries, meaning that there's bone protruding from the skin.
X-rays revealed the extent of the fractures in Elaine's middle and lower leg. Elaine is raced to theatre for surgery.
What we need to do is just put it into a good position, and then we can mainly deal with the soft tissue injuries as well. So there's quite a big laceration over the front there.
Chris's quick thinking already has saved Elaine from losing her leg entirely.
When she presented to Edie, she had no pulse in the foot. The foot was cold and deformed. So what he did was to reposition the foot, realign it, and therefore restore perfusion to the foot, after which she has had a pulse. So therefore, she has a viable limb. So that's an urgent intervention.
The surgical team has a big job on their hands, putting all the pieces of Elaine's bones together again. So they will only concentrate on her most high-risk injuries tonight, which are her knee and ankle.
Good. So the wound at the shin level is through the fat and is just into the layer of the deep tissues, which Mike is doing now. Going to give a good result there, hopefully, without infection.
The team will need to reconstruct her patella entirely, salvaging what bone they can and securing it with a combination of wires and screws.
And at the top end, you can see the knee wound. Now, Chris has opened up the knee. I think the fate was sealed at the time of injury. I don't think she will have normal kneecap function as she knew it prior to injury, but I think we will try to give her the best chance for things to heal up.
In the hospital's coronary care unit, miracles are a daily responsibility for Dr. Atifa Rahman.
When I was very young, I wanted to be a doctor, and when I became a doctor, I always wanted to be a cardiologist. In my world, besides my family, there is 2 things: cardiology and spare time cricket. Nothing else.
Alice, can I have a pair of gloves, please?
An interventional cardiologist, he specialises in using catheter lines inserted into patients' arteries to access their beating hearts.
That's the hot flush coming. We are a very busy centre, but we are very fortunate in Gold Coast. We have such a wonderful facility and we have such a wonderful service.
Up to 10 times a day, Dr. Rahman repairs damaged hearts while his patients are wide awake.
So the tube is in. You shouldn't get any more pain or discomfort from now on.
We got quite a few more patients remaining. It continues the rest of the day, probably until 5, 6, 7 o'clock. And we'll try to do as many as we can.
Maria, we put the stent in. I'm very pleased with the result.
Thank you.
Most of the days are busy normally, but unfortunately we haven't had a STEMI yet. So if we get STEMI, then it interrupts the day's planning.
STEMI is medical speak for the most serious kind of heart attack.
This is the medical emergency when the artery is totally occluded and we need to open those arteries very quickly. If STEMI comes, we just prioritize whoever needs to be done first.
Just as Dr. Rahman knocks off for the day, a call to 000 rearranges his plans for the evening.
Ambulance, what's the town or suburb of the emergency?
Sapatuma.
Can you tell me exactly what's happened?
I've got like chest pains that feels like someone's standing on my chest.
I'm going to get you some help there, okay? Did you say that your wife was there with you?
Yeah, my wife and son are here.
Okay, perfect. Now, we are coming to you at the moment.
A 57-year-old man is showing all the typical signs of a STEMI heart attack.
This is Daryl. He's experiencing some retrosternal pain radiating down his left arm, suddenly in onset first presentation since about 2:45 this afternoon. Described as heaviness, 9 out of 10.
Daryl, to cut a long story short, it may be that you've had a heart attack.
Any dizziness?
No dizziness, no nausea.
Any family?
Okay, guys, new plan. We're going to go straight upstairs, okay, please?
Daryl's wife, Jenny, has travelled with him to the hospital. There's a lot for her to take in, and things are moving fast.
Well, explain it upstairs. Go, guys.
This is the form of heart attack. We consider it a medical emergency.
Would you like to follow us up?
Yeah. Everything is time in cardiology. When it comes to heart attack, time is muscle.
Do you have any allergies?
If you are late in opening the artery, the muscle could die and they can have quite serious complication from that. So that becomes very, very important. Go, everyone on the run, rush, and then quickly open the artery.
With her husband's life hanging in the balance, the ride up to the cardiology operating theatre feels like an eternity for Jenny.
Is there anything else you wanted to ask at all?
Sorry?
Anything else you wanted to ask at all? Look, he's in the right place, okay? These sort of things do happen and we're in the right place to get this sorted out for you, all right?
It's very likely the artery is totally blocked there. So we're quickly going to do an angiography and find out which artery is blocked. And if there is a narrowing, we're going to go and try to put a stent there.
A stent is a permanent scaffold left inside the artery to keep it open.
We're going to go from the groin, which we'll try to hurry up and speed up the process to open it up.
It's only 10 minutes since Daryl was unloaded from the ambulance. But after a kiss for luck from his wife, the life-saving procedure must begin. Every moment lost, the more of Daryl's heart muscle dies. Elaine was the innocent driver of a car involved in a head-on collision.
That's right. She's stable at this stage. We'll be there probably about 10 minutes.
She suffered horrific injuries that needed to be fixed in emergency surgery.
She's actually shattered her kneecap into many little pieces, and our job is to restore this best we can to get things back together to where they should be.
I've broken my ribs, my sternum, my knee, the ankle, the leg, and that's probably enough.
But it's not the physical pain she is necessarily wrestling with. Despite being given heavy daily doses of morphine to combat her pain, nothing has dulled her memory of the accident.
Every now and then I wake up in the middle of the night, and when I can't move I think, I won't let them close my door. When I was in there with so many people inside that car, too many people in my space, You know, I wanted to get everybody away from me and just get up and walk away. And I sent my sister a text to say, I am so happy today. And then within an hour, a lot of that went.
Elaine has a long road to recovery in front of her. Doctors expect it will be at least 6 weeks of rehab before she will even be able to stand on her own. But at least she'll have her sister, who's flown in from New Zealand, by her side.
Could have painted your toenails or
Oh,
something.
I know, it's skin there.
Really, eh?
I know. When I walk in, then I'm going to paint them in celebration.
I reckon, eh?
I know. Another day, another new week. Yeah, and yeah, it's good.
"57-year-old office manager Daryl is having a major heart attack, known as a STEMI. The blood supply to Daryl's heart is blocked and the muscle is dying by the minute.
We're quickly going to do an angiography and find out which artery is blocked. And if there is a narrowing, we're going to go and try to put a stent there.
Dr. Rahman must find the blockage and restore blood flow before Daryl's heart fails.
Hello, please.
Using angiogram imaging and a catheter fed in from the groin, it's possible to see exactly what's going on inside Daryl's heart. Incredibly, he'll be wide awake the whole time.
It's going to be a little bit pushing in your groin. The tube is coming in. You shouldn't get any pain or discomfort. If you do, please let us know.
Straight away, Dr. Rahman finds the problem.
Daryl, you don't smoke, do you?
No.
Okay. We are about to take the picture of the right coronary artery. There is a narrowed area. Pressure, please. Take a gentle breathe in for me, sir, and hold your breath there. Okay? Breathe normally.
It takes Dr. Rahman just 4 minutes to make the breakthrough.
So the artery that's most critically narrowed, we'll go and try to open that artery.
Daryl's heart is being starved of blood. He could stop breathing at any moment. This catheter wire is inside an artery that should be full of blood and look more like this. Dr. Rahman's years of experience tells him to keep calm, but get the blood vessel opened as fast as possible.
A patient can die on the table just from the complication of the procedure. A patient can die from the complication of the disease process itself.
Fully conscious, Daryl has no idea how close to death he is.
You all right there, Daryl?
Yeah, fine.
Can I have the torque, thanks?
But his life can be saved using a tiny mesh cylinder called a stent. It's fed in through the femoral artery on the end of a fine wire.
Can I have the Renato wire? Thanks, and the introducer. Thank you.
Just going to go a little bit further. It's very important to keep calm and quiet during a difficult procedure when the patient is very unwell.
We'll take a picture, please. Thank you, yeah. You may get some chest pain. We're inflating the balloon now.
Once it's in place, Dr. Rahman inflates a balloon inside the stent. But will it be enough to open Daryl's artery before it's too late? "57-year-old Daryl has had the classic wake-up call health scare.
You may get some chest pain. We're inflating the balloon now.
Dr. Rahman has just inflated a balloon inside the stent, opening it to the size of the artery.
If you go up there, please.
Going up now?
The impact is immediate. From an empty blood vessel
Save that picture for
to
me,
a
please.
full one in seconds.
So the artery looks open now. Show me there, please. Daryl, the artery is nicely open now. We're just going to do some fine tuning. Is the still a little bit of pain, or is it gone? So it should start to ease off very soon. Yeah.
And with that, Dr. Rahman has finished another life-saving surgery in record time.
Everything went very well. We did the total procedure from the time he came into the hospital in 23 minutes. So that's going to save a lot of his heart muscle. It's very rewarding to see very sick patient coming to us, and we intervene, and straight away they're totally different. They feel so much better.
Did you feel that a bit?
No, that's good.
But Daryl isn't out of the woods yet.
There is some damage in your heart muscle we can see from the heart attack.
I always tell my patients, we have stented your artery. That's not the end of the problem. The disease process, you have to work and improve that by lifestyle changes and by taking medication regularly.
Two months down the road, Daryl has made the changes and is starting to enjoy the benefits.
The weight I've lost is probably about 6 kilos. Feel great. The change was just so easy. I had to roll with it. I've got a 10-year-old son, my wife. I had to think of them as well and make these changes and make it all happen. Yeah, Eddie, you start feeding. If I go back to my old ways of all the fatty foods and that, I'm not going to be here in 5 years. And that's why it's so important to keep up with your healthy eating, your exercise. Listen to what the doctors have said to me, and just carry on with it. The end result is I'm here, made the changes, and looking forward to many years in the future.
Same-sex partners Carly and Ali Jane never lost sight of what they wanted from day one. A family.
The nursery's being done forever, everything's done. I've got my birth plan done, the car seat's in the car.
But each IVF attempt over the past 2.5 years was met with heartache.
It took so long. It's not just 9 months, not an accident. It's so hard. You just feel crap about it, and then when it happens, it's just insane. Can't even explain it.
Today, Ali Jane and Carly are finally realising their dream. Carly is in the final stages of labour.
I was in the bath for a little while, and that kind of really slowed my contractions down. So she got me out, and as soon as I got out, I just felt this urge to start pushing.
Well, that'll be a baby anytime.
Holy head.
No, you good thing. Oh, that is so a baby.
The rest is over there at this heart.
With things progressing rapidly, it's time for Carly to get into a more comfortable spot for the final push. And the new position isn't the only change. Ellen's shift is now over, so midwife Cassie Julerat is stepping in.
Even if I get a mat or something for you to be on the knees already. Yeah, do you want to do that instead?
Yeah, almost here. You're doing so good, Carly.
At this point, all girlfriend Ali Jane can do is be there to help her through the pain.
I thought it'd be really scary, but it was calm and peaceful, and she was doing it like a pro. I'm so proud of her.
That's it, Carly, you're doing great now.
Your water's just broke, Don, so things might come a little bit quicker now, okay?
Baby Oakland is on his way.
A little bit of hair there.
Oh.
Yeah, that's it.
Oh my gosh, she's biting me.
That's it, Don. You're all right. You're doing great.
Ow.
Here comes his head. So next one, the baby's going to come out, okay, Don? That's the hardest bit, all right? Oh, it's head's out, Carly. Yeah.
After 4 rounds of IVF, with her mum Sandy by her side and clutching onto her life partner Ali Jane, Carly's African-American baby boy Oakland comes into the world.
Oh my God! It's so cute.
And while it's not the water birth she hoped to have, it's the miracle she had always wished for.
You're right. You did amazing, didn't you?
Oh my God, I love you.
You were just so amazing, weren't you?
He's so cute. I love you.
I'm so happy with how it went. The midwives were amazing and my mum was there the whole time. She got to sit next to me and see him come out, and so it was special to share it with her. And
I'm just glad Carly let me share with her this moment, because everything that they've been through, it's extra special. So, yeah, very proud of Carly.
Carly's crying. Get a photo.
He's dark, isn't he? Yeah, he's going to be quite dark. Aww.
His lips are huge.
Okay, do you just want to get in a bit closer together?
Carly, stop crying.
Shut up. There's something in my eye. Oh, I look like crap. Look at his, you can see him looking and everything. So cute.
Help, I have done it again.
I want to hold his finger.
Can you hold his finger?
Hopefully not my finger. It's pretty cute. You're about a 7.
It's been such a long time coming, 2.5 years of IVF and miscarriages and not ever knowing if I'd even become a mum. That's pretty special. But yeah, it's amazing. Yeah, I'm so glad he's here. I was freaking out, like I've been having nightmares that he was going to be stillborn or something. I just thought, it can't possibly happen because we've had so many knockbacks, and yeah, he's perfectly healthy.
Next week on Gold Coast Medical.
Did you see the knife by any chance?
A love affair where the first cut really is the deepest.
You've got a deep cut, possibly going into your liver.
A dream holiday turns into a nightmare.
So you got attacked by a buffalo?
But these patients have Nurse Katie to help them forget their troubles.
We'll try and get you some hot nurses.
Yeah.
So inappropriate.
And an extremely rare metal is inserted inside this man's brain in a miracle procedure.
The big challenge for us is to get safely into that vein. We may not be able to get there,